Hi, Dr. Yass here. Today's topic is one that has devastating effects on people and could sustain its level of intensity for days or weeks, and that is migraine headaches. And this is a topic that has very little known about the etiology of the headache. Certainly, there are potential medical issues that can lead to migraine headaches, such as hemorrhages of arteries, meningitis, tumors, things of that nature. And without question, if someone begins to have migraine headaches, they should immediately seek medical care so that the appropriate diagnostic testing can be performed to determine whether the cause of the headaches is something from a structural nature, such as I said, a stroke or a tumor or meningitis, something of this nature. There's no question that there are serious potential causes. The question really lies in what happens after all the diagnostic testing has been performed and it turns up negative. And it appears that the headaches, the migraine headaches, are not coming from any type of severe situation. What are the options that are offered? And primarily, it's medication or injection. So eventually, once you get to the point through the existing medical system where they cannot establish the cause of the migraine headache, you are now left in the situation that many people find themselves when it comes to pain, which is the simple attempt to address the symptoms, the headache itself. And so you have a few different types of common medications that will be given. And again, what is that going to do to address the cause of the headache, the migraine headache? Nothing. Zero. So once you end up on this path, you must recognize it is a terminal, indefinite situation. As far as the medical system is saying, you could plan on having migraine headaches for the rest of your life, and at best, we could probably try to help you cope with the headaches. That's a very, very scary place to be. It leads to hopelessness and depression and anxiety because you never know when the headache's going to come on, the severity of the headache, and whether the types of treatments provided will reduce the headache level enough to where you can just simply exist or perform your daily activities, such as working, caring for children or family members, doing recreational activities, whatever it is that you have to do or like to do in your life. So that's where most people who have had migraine headaches end up. And this is a situation that can certainly have gone on for years. The one type of situation that is not readily accepted or even acknowledged is the idea of the migraine headache coming from tension in the muscles that attach from the shoulder and shoulder blade complex to the upper cervical region and even the skull. The two primary muscles that can be a factor are the levator scapula, which attaches from the inner upper corner of the shoulder blade to the upper cervical region, and the upper trapezius muscles, which attach from the shoulder blade to the skull. If these muscles were to become overused and strained, they could pull excessively on the upper cervical region and even the skull. And since the skull has connective tissue called periosteum surrounding it, pulling on the periosteum in the back could create pain anywhere within the head. So there is no question that there is a logical theoretical basis that tension of those muscles can lead to headache. So the question then becomes, well, is there any indicator, physical indicator, that this might be you? Well, all you have to do is look at your posture and see, are you one of these people that sits like this, or are you one of these people that sits like this? If you have forward shoulder posture and forward head posture, that is typically the result of an imbalance between the muscles of the chest, the bicep and anterior deltoid, versus the interscapular muscles, the muscles between the shoulder blades, the posterior shoulder muscles, and the triceps. As a result of these being stronger, they pull your shoulders forward, which cause the shoulder blades to separate from the spine, elongating any muscle that attaches from the shoulder blade to the upper cervical, to the spine, or even to the skull. So the muscles become overstretched. They lose their ability to perform their task. In the case of the levator scapular and upper trap, it's to support the head. Well, you're going to have to try to live your life, and your head's going to still be up. And so they're going to keep trying to support it, but because of this improper position and posture, they strain, and in straining, they pull excessively. The tension in the muscle increases, leading to the possibility of them pulling on the periosteum, eliciting a migraine headache. Now, does the medical system have any sense that it might be muscular? Well, what's one of the biggest products sold on television? You see the commercials all the time for addressing migraine headaches. Botox, botulism. Most people hear the word Botox, they don't realize that's bacteria. Botox is botulism. They're injecting it into your muscles to paralyze them, to try to make it so that they don't strain. That's the idea of how the use of Botox to address migraine headaches is supposed to work. I can tell you from personal experience that in 2 cases, 2 women had injections into the muscles, and apparently either they hit the muscles in the wrong way or they injected too much medication, and they ended up with their chin on their chest, and they were incapable of raising their head for months. For months, this is where they ended up, because they had paralyzed the muscles in the back so severely. So if you decide you're going to go the Botox route, just realize, number one, you're all worried about the coronavirus 9 cents, but you're willing to inject, literally inject through your skin into your body, botulism? I think maybe you want to take a second thought about that. And secondly, the ramifications. You're injecting something through your skin, so bacteria can always get through that. It could be on the needle, right? So that's dangerous. And you're injecting a bacteria, botulism, into your body. But the fact that they're using Botox, which is an attempt to paralyze muscles, indicates they do recognize that in many cases, migraine headaches are muscular-based. But in recognizing that, does injecting it with something to paralyze the muscle resolve the cause? Of course not. That's insanity. The only way to truly resolve the cause is to resolve the imbalance that led to the muscle straining. Stretching of the chest, strengthening of the rhomboids, the midtraps, those muscles between your shoulder blades, the posterior deltoid, the lower trapezius muscles, the upper back complex. Strengthen those muscles, pull the shoulders back, maintain proper head position. I will guarantee if the cause of your migraine headache is tension from those muscles straining, you will end it. There is a correlation between the migraine headache, the weakness of the muscle, and the improper posture. Think about yourself. If you find yourself sensing weakness, having forward head and shoulder posture, and getting migraine headaches, does this not sound like a solution to you? A viable way of resolving a cause versus doing nothing more than addressing symptoms? If so, get off your butt, find out how to contact me, get the Yass method, do the exercises, and within a few weeks, migraine headaches will be a thing of the past. I have used this method to resolve many, many people who have been suffering from migraine headaches, and they do not get them at all. It's an option. It should make sense. Go through the process. Make sure there's nothing serious. Once you establish there's nothing serious, think about, is it possible that the cause of my migraine headache is muscular-based? Look at your body. Look at your posture. Sense if you're weak. If you are, there's a high probability there is a correlation, a connection. Do the exercise properly with the appropriate resistance, And by the way, just to reinforce, that understanding of that type of exercise and the use of progressive resistance is not part of any curriculum, not physical therapy, not chiropractic, not kinesiology, not personal training. None. This is something I developed through 33 years of weightlifting, 27 years of treating people. That's what makes this the Yass method. So, with this understanding, at this point, if you've decided, you've watched this video and it makes sense, you can contact me by email at drmitch@mitchellyass.com, DRMITCH at MITCHELLYASS.com, drmitch@mitchellyass.com. If you want more information, I did a chapter in my book, The Pain Cure RX, the chapter on the neck, which also talks about migraine headaches. If you decide you'd like to have me involved in addressing your issues and you would like to do an evaluation and treatment with me, I have for years been doing Skype and Zoom evaluations and treatments. This is not something new to me. This is not part of the telemedicine push that's now happened since the coronavirus. I've been doing this for 5, 6, 7 years already because of the fact that so many people have sought me out from places well outside the ability to reach me in person, that I was required to utilize this technology. So it's not new. Again, if you decide that's the direction you want to go, you can contact me by email, drmitch@mitchellyass.com, to make an appointment. Right now, we're looking at 3 to 4 weeks out. So please, if you decide that's what you want to do, let's get you on the schedule as soon as possible. If you like this video and you think there's value to it, please give it a thumbs up. This helps me to increase my value in the types of videos I'm providing and increases my rating with YouTube and with Google and helps them provide this type of information to people who may be suggesting the types of these topics when they do their searches. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe. This is the type of information you need to get. I will talk about all types of topics relating to pain, even topics associated with pain or other symptoms. We'll talk about function. How do you improve your function? Quality of life. We'll talk about exercise. There's going to be a lot of information. And most importantly, this is application that is applicable. You can use this information to resolve your symptoms and achieve the quality of life you're seeking. This is not just to be put out there so that you can get a lot of subscribers and make money. That's what separates this from a lot of other people out there. They're just putting on a lot of baseless information that has very limited value just to make money. That's what this is not. This is not what this is about. This is about helping people get their lives back. I've worked with way too many suicidal people who've wanted to give up on life because they couldn't take their pain anymore. That is a sobering experience to go through, and it is what has pushed me to continue to create awareness of the Yass method, which is completely independent of the medical system. It is something I developed on my own and is extremely effective. I hope you're willing to make the jump from the existing system to the Yass method. Give it a try. Just like so many thousands of others, you will see that you can have a pain-free, great quality of life. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.